My name is Fabiola Martinez, and my title here in the company is the Clinical Operations Manager. I've been with the company for 10 years now. I had initially heard about Grading Family Health when I was pregnant and I was given information to come for the WIC program. I was in school for a medical assistant, and I decided I wanted to work in a place with an environment that I felt, as a patient. So I did apply as soon as I graduated, and I was hired as medical assistant in Sycamore. A little after I had my daughter, and I transferred to full-time medical assistant in one of the Elgin locations. I decided to go back to nursing school part-time, and then I did get a lead MA role for about a year. After that, I had to start the nursing program full-time, so I had to drop down to being part-time. After graduating, I applied to work as the employee health nurse, so I did that for about maybe like a year, and a little after that, I was given the role of the clinical operations manager. Eventually, I was able to transfer to a bigger location, which is where I'm at now, where we have all the specialties. So I've definitely been able to professionally and personally grow while being at the company. Now that I've been clinical operations manager for the last 3 years, I did go back to school, and I just graduated from my nurse practitioner program. So
my name is Oscar Amezquita. I've been with Greater Family Health for 13 years. Currently, I'm a clinical operations manager for 2 of our health centers in Streamwood and Hanover Park. My family were actually patients of Greater Family Health. Some still are today. I remember coming in with my parents to their appointments, to help them navigate through the process of registration. And I remember seeing the front desk staff, and I was very young at that time. And I remember thinking to myself, man, I want to do that someday, and just seeing that my parents were getting help that they needed. I kind of wanted to do that myself, like that, light up something in me, like a passion that I had to want to help others. So I started as a receptionist with Greater Family Health. I was responsible for welcoming patients into the health center, assisting them with the registration process, explaining registration forms to them, doing insurance verifications, collecting payments, scheduling follow-up appointments, making courtesy reminder calls to patients. I then moved on to a clinic coordinator position. As a clinic coordinator, I was in charge of overseeing the front desk staff. So I was responsible for the day-to-day operations of the front desk, scheduling staff for the health center to appropriately meet the needs of our patients, responsible for ordering, janitorial supplies, as well as office supplies. After covering as a clinic coordinator for multiple of our health centers, I then moved into the role of call center coordinator. As a call center coordinator, I was overseeing our phone operators. In that role, I was responsible for maintaining the service levels of the call center, hiring and training new staff that came on board. I was also responsible for de-escalating any patient complaints and providing assistance to our phone operator staff to meet the needs of all callers. After that role, that's when I became a clinical operations manager.
My name is Yashira Alegria, and I am a care manager currently. I've been with Greater Family Health for 10 years. I started as a receptionist, and I did that for about a year, but I was at nursing school. So after nursing school, there wasn't anything for me here just yet. I left for about a year and reapplied, and because the organization already knew who I was and how I worked, they hired me for my next role. When I came back the second time, I started as a pediatric nurse, and at the time it was a new program that had started. We were putting together the VFC program, and it was something that had just recently gone digital, so we didn't know what to do with it, so I helped to put all that together. From there, I realized that I wanted to apply for a clinical operations manager role, and a lot of what I was already doing was the role that I was applying for. So essentially, I proved myself as a pediatric nurse and then was able to transition into what we call a comm role. What was added to that role was supervisor responsibilities. So the hiring, the training, the disciplinary action for medical assistants, the day-to-day operations of the health center, supporting of the clinical staffs, the providers, managing of the schedule. So there was a couple of things that were added. For that role, I did that for about 4 years, and I wanted to be challenged again. So I applied for the quality risk manager role, and that involved us having to assess any current risk and potential risks. What I was doing in that role was more of observation. I would go into the rooms with the medical assistants and with the providers, and I would audit what they were doing with our patients. And the goal was to see what areas we could improve in. So my current role as a care manager, I am helping patients find resources and helping to support them in their healthcare needs. So for example, I will review patient admissions and contact the patient, determine if there's any needs, any education that they need after their discharge, and continue to follow up with them monthly if they choose to, so that we can continue to make sure that they're not going to the hospital, that they understand their health care, and support them with any resources that they need.
Once I transitioned into the nursing roles, it has been more so a good place to do where I have a work and home balance, where I'm able to go to school after my work hours. When I'm at work, but I have enough time after work, weekends, where I can go to school and dedicate my outside time to school. My daily motivation is help others, specifically I would say the underserved, which is why I love this company so much, and that's why I've stayed here for so long, because that's what we do. We help the underserved. They are the ones who need us the most. So to me, that's the most rewarding part of my job, which doesn't feel like a job, just I truly love what I do.
The mission of Greater Family Health is really what drawn me to want to apply to work here. I wanted to be a part of an organization with a mission to help others in need. As I mentioned earlier, my family has received medical care here, and I would think of myself, wow, I really want to work there. The years that I have with Greater Family Health are a testament that I have had a very positive experience here. I have been given opportunities to grow, not only professionally, but personally as well. I have had great leaders and mentors that have helped me, and they have guided me to achieve, my goals and to be where I am today. And for that, I am very grateful. I know that it doesn't end here, and I know that I can continue to expand my skills and continue to grow in this organization. I am grateful that the organization offers the opportunity for growth.
I really like the mission to provide quality, affordable healthcare for all, even those without the ability to pay. I like that we're not driven by dollars, but we're driven by patient outcomes. And that's something that's evident in the way that we do things, the training that we provide our staff, the way that we have our health center set up, the top of the line equipment that we have. It's just, we're constantly pulling in resources for our patients and for our staff.
For those of you who are watching this video right now,
For you watching right now,
if you're watching this video right now, I would recommend to keep going. I would just encourage you to keep moving forward, even if it takes you a little bit longer. It took me 8 years to get my bachelor's, and we all know that doesn't take that long, but it was because of other factors in my life, and I just kept pushing forward, and you can do it.
my advice to you is don't get discouraged, keep working. The time will come where you will be able to celebrate you reaching your goals. So keep working hard, and be patient.
My advice to you is to have goals, to believe in your abilities, to work towards achieving your full potential. Do not get discouraged just because something doesn't happen right away. Have a vision. Focus on your education, most importantly. Be patient with one another. We learn from our mistakes and we grow from our struggles. Be kind to one another. And when you get to where you want to be, do the same for someone else. Help someone achieve their goals by encouragement, by mentorship, or simply by being there for them and cheering them on.